Welcome to Part 4 of the Mindray Benihart D3 Defibrillator training series. In this video, you will be shown how to use the manual defibrillation function. To prepare the patient for manual defibrillation, remove the patient's clothing around the chest. Wipe any moisture from the chest. Clip or shave any excessive chest hair. Attach the pads to the chest. Use the standard anterior lateral placement position. If not already connected, connect the pads to the patient shock cable. Next, turn the mode dial to manual defib. In manual defib mode, users can see an ECG waveform, a heart rate display, a CO2 waveform, CO2 numerical information, an impedance indicator, a defibrillation information window. There is also an elapsed timer, clock, and battery status indicator. Users are also able to change the patient category from adult to pediatric or neonatal. To begin delivering a shock, select the desired energy level using the Energy Select buttons. For adults, users can select energy outputs of 200, 300, and 360 joules. To charge, press the Charge button. Once charged, the user will hear a change in tone and see a flashing shock button. When ready and it is safe to do so, push the flashing shock button to defibrillate the patient. To help ensure successful defibrillation, an impedance indicator can be seen on screen. A green light indicates an acceptable level of impedance. Amber and red lights indicate that impedance is too high. Users should not delay delivery of the first shock regardless of the impedance. After the first shock, high impedance can be reduced by checking the pad positions and cables connections. Changing the pads should also be considered. To use CO2 monitoring, select the appropriate filter line and twist clockwise into the adapter port. CO2 monitoring will automatically display and auto-zero once connected to the patient. Push the Event button to manually mark any significant events. Select a choice or generic from the menu. After the rescue, an event summary can be printed by accessing the menu and Others submenu. Clinical information can also be reviewed by accessing the Archives menu. Pre-configured events will automatically print. To print manually, press the Start/Stop button. After the rescue, turn off the device. Remember to replace any consumables that may have been used and ensure the device is placed on charge. That's the end of Part 4. Thank you for watching.